Good evening, I'm Cynthia Hessin, and we're glad now to continue our focus on successful children with Paul Tough, the author of How Children Succeed, and of course, Dr. Carl Clark, CEO of Mental Health Center of Denver. We'd also like to introduce Steve Nederveld, who is with Denver Public Schools. He's Program Manager of Mental Health Services, a licensed clinical social worker, and Charlotte Brantley, President and CEO of Clayton Early Learning. Last but certainly not least, Dr. Lydia Prado, Director of Child and Family Services for Mental Health Center of Denver. This has been great to have a chance to listen to Paul talk a little bit, and I know you're familiar with his work, Dr. Clark, but what did you think as you were listening to him just now?
Well, Paul, first I appreciate the work that you've done of looking at the science and putting it out to the community in an understandable way. And I think for those of us that sort of work in the community, the big questions that we're going to have in our minds is, well, how do we take the science and really make it practical? How do we do interventions that are going to have meaningful impact with the kids and families that we work with? We do have the experience that families are hungry for help, and that they often have ideas about what will be helpful to them, and how do we create that dialogue with them and then translate that into, let's put the science together with what you're talking about and move ahead.
Let's continue and let everybody have a chance to say something here. Steve, I overheard you before we started taping saying that you had already been reading Paul's book when you heard, yay, he's coming to Denver, right?
Yeah, I would just kind of expand on that, specifically within Denver Public Schools, and say it kind of made me rethink our interventions from a student focus, since Denver Public Schools obviously serves K-12, to are we engaging parents enough? If a lot of the need is to support parents, we have another department that focuses on parent engagement, but maybe our interventions need to have more of a parent engagement focus too. So that we're connecting, and we're in partnership with MHCD, Mental Health Center of Denver, on some of these efforts to get parents more involved in our student interventions. And then the other thing that I think the book really made me think about was the fact that we, as a staff of mental health professionals, maybe aren't focusing as much as we should on trauma, on how students take in with them stress. And we may be reactive or even make them more reactive if we're not managing that and helping them. We're not going to take the role of the parent or the caregiver, but we also need to make sure we're not kind of re-traumatizing them by having school be a stressful environment, or not treating them as therapeutically or as supportively as we should.
Charlotte, you have certainly been dealing with a lot of this at Clayton Early Learning for a long time, and we've known for a while how important early learning is. The idea of parental involvement is old too, right? About how to draw people in, people who don't always have enough time to be spending with their children when they're working.
Right, and it truly is so essential. And I was saying to Paul earlier this evening that one of the things we really try to do at Clayton Early Learning is to send not only the children off to kindergarten really prepared for success, but also their parents off to kindergarten, if you will, very prepared for success. For many of the families that we serve, their schooling in K-12 was not necessarily their most fun experience of their lives. They're sometimes intimidated by where they're going off with their children, and we really try to give them that sense of confidence as a parent, that they can continue to be both their child's best advocate within the education system and also can continue to really play that role of their child's first teacher, the person in that child's life that child is most dependent upon, and to try to give them some tools and some skills for feeling very confident in that role as well. So I find his book quite actually hopeful in terms of some of those strategies that he talks about.
And Lydia, as head of Child and Family Services for Mental Health Center of Denver, we live in such a more complicated world than most of us experienced in our childhood and so forth. Has that really changed a lot of how you are helping families and children?
I think we have to keep the context of families today in mind with everything we do. But what I really walk away with from Paul's book is sort of the promise of early intervention. You mentioned very specifically that there are certain parenting behaviors associated with attachment and sensitive parenting and nurturing parenting that can be taught, that folks can learn and then go ahead and practice with their children, so that someone that looks anxiously attached or a disordered attachment that we might see, you can see movement along that. And so I think we're on the right track in terms of our interventions, which really focus on supporting healthy social emotional development, which all happens in the context of a positive emotional quality between caregiver and child. And I would like to add that I think the other message is that no one organization, no one group can do this by themselves. So Paul is talking about academicians and the stress research, educators, mental health specialists, and I think what the world is going to look like is it's going to have to be a collaborative effort. We're going to have to get everybody involved to do what we know, exactly, to do what we know is best to support children and families.
Well, I was interested too. A few years ago, I did some work with Dr. Del Elliott at the Center for Prevention of Violence in Boulder, and I was struck ever since then that if a child has just even one adult who can take an interest in what he or she is doing and really focus on that child, they have a much better chance to succeed.
I think that's right. And I think the balance that we need to strike when we're thinking about what sort of interventions work best is that these parenting interventions that I talked about and that a lot of us are talking about tonight are really crucial. And parents are in the best position, especially in the early years, to help their children succeed. And the fact that there are some interventions that can help improve parenting, I think is really enormously hopeful. But I think it's also true that there are lots of other moments in a child's life when we can intervene. And in adolescence, at school, and that a lot of that is about relationships. It's about connections between adults and children, and whether those adults are family members or teachers, mentors, coaches. There are all sorts of moments where we can help children do better. We can be that person that finds that one connection with them.
Is it hard for a child to attach to one person? Is that easy to do, or is there something that you need to do to facilitate it as an adult? Anyone?
I'll start off by saying, I think it's a pretty inexact science. So, I spent some time in my reporting working with reporting on a mentoring program with some really troubled kids, adolescents in Chicago, and some of the matches between mentors and children worked really well, and some of them didn't. And it wasn't that the mentors were better or worse; it was just this chemistry. And so I think it's a little frustrating when we want some clear answers about, okay, here's how you be a good mentor. Here's what good mentoring looks like. There are certainly some things that we know and that we can pass on, but I think there's also a little bit of alchemy there. That when young people are ready for that kind of help, and when they happen to find the right person, it makes a big difference. So putting as many of those adults in their way who can be that right connection, I think, is the strategy.
See whether something will sprout along the way.
Right.
Yeah.
I can add that just listening to, we have a suicide prevention program, and I'm fortunate to do training with young people that are involved. And oftentimes when they are suffering, when they have had a traumatic event, they know they're looking for something, and they are pretty clear actually about who they're looking for. They will say they have to listen. They have to see me and not some external part of me, and not react to a presentation. They comment about feeling invisible because people see them and think they know them without really getting to know them.
Based on their haircut or their pants.
And so it's really about, it's kind of like that same need we have throughout our lives is to be honored and validated and for who we are. So they're looking for that, and they're looking for somebody that's open. But mostly what I hear is that I want somebody to really listen and kind of just bear witness to my experience, for lack of a better word.
If I may add to that as well, we have a curriculum at Clayton called Learning Through Relating that we use with our infants and toddlers. It's both a professional development tool for the teachers, it's an assessment tool, but it's also all about those teachers creating a very warm and loving relationship with one or two of the 8 children. It's 3 teachers and 8 children, so they're creating these very warm relationships. And I would tell you that what you're describing in terms of adolescence is just as operative in 1-year-olds and 2-year-olds. When that connection is created between that toddler or baby and that adult, you can see that sort of synergy of relationship going on there, where the infant toddler is just as badly wanting to be heard, if you will, even though they can't verbalize it yet, and has to see that in the eyes of the parent, of the caregiver, of the teacher, that person is respecting that little tiny person. It's very important.
I think, in speaking from kind of a urban, large public school district, there's often not somebody identified as the mentor in the school, but it takes someone taking kind of that extra time. Where obviously, teachers now have classrooms of 30 plus students, and it may be difficult for it to be the teacher, but I'm encouraged by the fact that, at least kind of in connection with the book, How Children Succeed, is the fact that Denver Public Schools, as an example, is putting more money into mental health services than increasing safety and security guards. Not that there's not a need for them as well, but focusing more on what is it going to take to keep our most at-risk students in school, rather than kind of going with this suspension route or this expulsion route, saying the students that are the most difficult to have the relationship with are the ones that need the relationship the most. So let's do everything we can to keep them in school. Even if they need to be suspended, have them do an in-school suspension or something, that keeps them connected to the school, rather than kind of pushing them out. So
that's good.
Kind of that idea of more people in front of the student to build relationships with, instead of kind of saying certain students shouldn't be here.
Paul, how did you ever get involved in this topic to begin with? What made you look into it?
So my first book, Whatever It Takes, was about the Harlem Children's Zone. 10 years ago, actually, this year, I met Jeffrey Canada, the head of the Harlem Children's Zone, and I started off just thinking I was going to write a magazine article about him, but then that turned into a book that took 5 years, and then when I got to the end of that book, I felt like there were still some big questions that I wanted to ask and try to find the answers to, in terms of why some children succeed and others don't. So that's what set me on the path to do this new book.
It seems like adolescents go to some lengths to let you not know who they are. I mean, they may be saying, see me for who I am and not the earring in my tongue, but they make it tough on an adult, I guess is what I'm saying. Would you agree, Steve?
Yeah, but I think they're often testing to see, are you going to commit to this relationship despite kind of the behavior that I'm exhibiting or the challenges that I'm bringing up. So I think sometimes it's to see, especially if they've had that 10 to 15 adverse, experiences or traumatic experiences, they may see as school or as this relationship just one more kind of failure or, person that's going to abandon me rather than. So I think you can't take the bait. You can't say, or you can't give in to that kind of posturing. You have to continue with the relationship despite that.
Dr. Clark, in the years that you've been doing public health, this has changed, hasn't it, in terms of how we try to help children who are at risk?
I think it has. Part of it is this whole concept of adverse childhood experiences. We know this happens, and how can we create what we call a trauma-informed approach to the children and families that we're working with. I've had my own experiences where I went to an emergency room and I was thinking, well, I'm a pretty relaxed guy, and I remember the interaction I had with the staff member there, and I thought, if I wasn't so put together, I think I would have decked you right there. and a lot of our systems do that. We interact with kids and families in a way that really set them off again. And so how do we change that? How do we have better approaches to what we do with kids and families? And I'm thinking about the school setting. People pick out all kinds of ways to self-soothe. Some of them are healthy, some of them are not healthy. The most common one, repetitive rhythmic motion. I mean, that works, right? It's why we see rocking chairs in airports now. And so I think about the adolescent who's at school in his chair with the legs up like this, rocking, and the teacher says, 4 on the floor, buddy. And it's like he was self-soothing, and then he goes and beats somebody up on the playground. Do you see what I'm saying? So I think we can think about these things in really broad ways about our approach, and then how do we connect with, see me for who I am.
To what extent, you were talking about how your son has become sort of your little guinea pig. So how do you think that's going to affect him? Who's he going to be in a couple of years?
Well, we'll see. There may be a sequel. So he's 4 now. He just started pre-K. So far, he's doing great. I don't think he's been too adversely affected by being my guinea pig. But it really, doing this reporting and reading all this research has really affected the way that I've behaved as a parent over the last 4 years. And I think partly it's just been about taking these skills and taking mental health seriously. That I think is a big part of parenting. And I think when he was born, I was very much trapped in that cognitive hypothesis. I thought I had to get all those Mozart CDs right there in the maternity ward, or he was never going to amount to anything. But I think doing this book helped me understand that there were other qualities that it was my job to help him try to develop. And it's not a clear science. There aren't clear answers. I certainly made a lot of mistakes. But I'm glad that it's something that I've been thinking about, and I think I'll continue to.
That can't help but be good. Are questions coming from the audience? We'll collect some of those, but in the meantime, I was going to ask you, Steve, what about cultural barriers? You certainly have a lot of diversity in Denver Public Schools that, there are a lot of different parent-child relationships in different cultures.
Our staff, you kind of hit the same kind of point I would make. We're not there yet or perfect in our ability to work with all students or all families, but definitely a priority in our staff development and our focus in training is to be culturally responsive. That takes a more diverse workforce too, so anything we can do to make sure that our teacher and support services population reflects as best we can the student demographics. But also, I think Lydia hit on it, that what students need is someone to be listening, supportive, responsive. If they see that, there's not a judgment coming, but a support coming or a best interest of the student in mind, they're going to not focus in on what the staff member looks like versus, is this person safe? Is this person supportive of me? Is this person trying to motivate me and get me towards the goals that I have? So I think it's a both and. We always want to be more diverse and be culturally responsive, but we also, I think, need to have kind of high nurturing and high support for our students regardless of whether we're exactly mirroring our student population or not.
Charlotte?
I was just going to say that I would suggest the same is true for working with parents. If the parents are feeling like the staff in their child's school or child care center or wherever it might be are also there to help them too and want to create a relationship with those parents, that can also help with what's going on with that child at home, because the parent is also being listened to and is being seen for who they are, and it just creates kind of that whole cycle of support around a child when everybody is kind of in this together around every aspect of the adults around them are supportive.
I think that's a really important point. And the other thing that I've heard and come across oftentimes is that the approach of assuming that there's strengths built in, that there are such a thing, that culture offers strengths and protection, and that offer a variety of different kinds of supports, that if parents and children are approached as if that's embedded in who they are, that's a good thing, and that we can all benefit from learning about that, and their children can benefit, and they can benefit from us recognizing those strengths, that takes the relationship building one step further. It goes a long way.
So, Paul, here's a question for you. On the one hand, Paul characterized adversity as the experience of failure, maybe the internal experience of failure, and on the other hand, an external event, such as divorce. Are the appropriate nurturing behaviors for different adversities categorically different?
No, I don't think so. I think every adverse experience that our children face, each one is unique. But I think the basic strategy of how to help kids through those moments is pretty common. And I think, to my mind, especially with older kids, if we're not talking about the licking and grooming age, the difficult balance, I think, for parents or teachers or anyone else to strike is to be, very responsive, very connected, very sympathetic with what the child is going through, but also not to send the message that it's the parent's job to solve the problem. If the child, is having a conflict with a teacher or struggling with a particular class, I think there's lots of ways that we can be supportive and helpful, but I think we can be too helpful as well. And so I think there's a need to convey to children, this is something that you can get through. You do have the inner strength to make it through. It's a difficult balance to strike, but I think when we can get it right, it's exactly what kids need.
All right, to anyone, what opportunities does health reform create to support children and youth social and emotional health? Do you see anything there?
How much time do I have? No.
Well, between now and the exchange opens October 1st.
Yeah, so the thing is that one of the good things that happened with the Affordable Care Act is that mental health and substance use treatment were considered to be essential benefits. So all the things that will be offered from this point forward will include those. And it's estimated that 39 million more people will have access to mental health services than have it today. And that's a good thing. The tough part of that is the workforce. So we are a very busy center as it is right now, and there are a lot of dynamics that go into how people decide to go into this field or not, and the expense of colleges actually influences that. And so how do we create meaningful experiences as people are going through their education to want to go into this field? So we've got some big challenges around that. The other thing is that eventually there will be payment reform. So in the U.S. right now, we pay healthcare to do stuff. It doesn't really matter whether you get better or not. You get paid to do stuff. And in the future, it's really going to be more about paying for outcomes. And when we shift to paying for outcomes, people are going to start saying early intervention and prevention has to be paid for now. Because right now, frankly, we have to fundraise for those kinds of services because they're not paid for by healthcare.
Even though they may be the most cost-effective in the long run, is that what you're saying?
Exactly.
Well, I see that as the promise of healthcare reform. It's moving towards a tertiary treatment, let's wait till they get very sick model, to let's keep the population, you're serving an entire population and keeping those that are well as they can be, intervening early and giving us a broad range of strategies that typically we haven't been encouraged to develop and implement. But along with that, we have to have the payment reform. So I believe that's coming.
Yeah, health reform has a way to go.
Yes, it is a little bit.
So much of school's focus is on test scores and success. So how do we teach young people that it's okay to fail and that it's part of the learning process, or how to persevere in the face of failure?
Everyone's looking at me.
You haven't talked in a while.
Well, I think I'd first like to say, kind of in a similar perspective that the two of you just mentioned with schools, I don't know if this is going to directly answer the question, but the focus on a small percentage of students, say 5 or 10% of students have mental health concerns, and we're going to wait for them to come to our office as a mental health professional. That system doesn't work. I think what I appreciated the most about the book was mental health or social emotional supports for students should be taught to all students rather than wait for certain students that are struggling and then, they need social emotional support. That model assumes that 90% of students don't need social emotional curriculum or learning. So I know that's not a direct answer to your question. I guess I would say around teaching students to fail, most of our students academically will fail at some time. I think we need to make sure that our students don't expect, and I've had these conversations with my children, standardized testing isn't about assessing are you failing as a student or not. It's a measurement for teachers and for principals to determine are we making the growth we need as a school. So I don't know if that's kind of what the question is getting at.
That's by way of making them feel less anxious about
it.
I
think we need to make sure our students know that there's certain tests the schools can administer that really aren't a student performance measure for the student to get feedback as much as how are we doing as a school. But I think the aha moment that the book made me think of too is not failing is not our mission. Because if we're trying to keep our kids from that idea of failure is a negative thing, I like the fact that science supports that doesn't do anything good for our kids in the long run anyway. So I think it's a good reminder for teachers to not assume that if I'm grading a student poorly and they're failing, that's a negative thing for the student. It could actually be what the student needs.
But that's got to be a pretty fine line to balance as the teacher or as the adult to say it's okay to fail, but we really don't want you to fail. Mm-hmm. We're here to make you succeed. Mm-hmm. The next question I have for you, Dr. Paul Tough, is, are you aware of any parenting curriculum, in other words, teaching kids how to be parents in middle or high schools to prepare them to be more successful as adults and, of course, effective parents?
I don't, no. I mean, I think... we don't want to encourage middle and high school students to think about parenting too soon.
Maybe waiting a bit on that.
But I certainly understand the sentiment behind that question, because I think a lot of what I think goes into being a good parent is part of what goes into being a good adult. And it's very much connected with what a lot of those kids are struggling with. So I don't know. Maybe there is a curriculum out there. I don't know.
There are a lot of what we would classify as evidence-based parenting, education, psychoeducation curricula around. If somebody was interested, they could look at the National Registry of Effective Programs, and there's a huge list of things that have worked in a variety of situations for a variety of different kinds of family constellations. And again, they're all demonstrated effective. So there's changes associated with
that is
learning.
Fantastic. There's a National Registry of Effective Programs.
Yes, there is.
Wow. You could look up anything there, right?
A lot. There's a lot.
Let's talk about lick and groom. Can the community lick and groom, or does it really need to come from the primary adult or adults in a child's life?
You're looking at me. I'll start with that. That brings on some odd things to think about. But a community at large, absolutely, I would say that the community is just as important a supporter of very positive child growth and development as is the family, as is the school. You mentioned earlier as we started, it takes a village. And we really do believe, in early childhood especially, that it does take a village. There are people in a community who may or may not be related to the child who could become that mentor to that child, who could become the mentor to the parent of that child. Particularly important, I think we've talked about mentoring of teenagers, middle schoolers and high schoolers, but mentoring of parents is also extremely important. And there can be members in a community who might even be the not your usual suspects, if you will, who could get involved in something like this, that could really make a difference for a child, for a family, to be supporters, and that it's not just up to the schools, it's not just up to the mental health specialists, not just up to the parents. The community at large can really support trying to make children grow up much more healthy and strong.
Thank you all so much. I actually have more questions. I'm hoping whoever turned in a question and didn't get it answered will come up and speak to our panel as soon as we wrap this up. Thank you very much to author Paul Tough and to Charlotte Brantley, also Steve Nederveld and Lydia Prado, and Dr. Carl Clark of Mental Health Center of Denver. We thank the Mental Health Center of Denver. We hope that all of you here in the audience will take a Growing Healthy Family seed packet and pot. Did you see those out there? I can tell you I've only had one for 5 days and it's already sprouted. So growing a successful little pot is very, very easy to do, apparently. Thank you all for being present tonight.
Thank you.